So I want to talk about injuries and how they affect your voice. I had two people from two different sources, one from Reddit, one from a post I made on Facebook, saying that I had some excess tension in my voice. And I was thinking, like, how is that possible? Like, I studied, I know that, like, all of my support has to come from here, and, you know, I have this really crazy range, but then I was thinking, like, they're probably right. If I'm hearing it from two different sources and it seems like really constructive criticism, there's probably something going on here. And, you know, I'm always trying to keep my mind open as much as possible, and I believe that, you know, staying a student for life is the way that you progress. So I really wanted to talk about this because it was something I wasn't even conscious of. But basically, when I was snowboarding, and this is going to tie back into singing in a little bit, but I'm going to give you the backstory. When I was snowboarding, when I was about 17, I was trying to do like a 540 over this, like, I don't know, maybe 20-foot jump, and a huge gust of wind hit me right as I was like approaching the takeoff. And by then I was kind of already committed to the jump mentally, so I just tried the trick anyway. And I remember like spinning around funky, and I landed like on my side, and there was I remember this big ice chunk just hit me right in the side, like right here, and it hurt so bad I thought I broke my rib. But I got on the lift chair, and there's a ski patrol guy. Yeah, go right back up for another run, right? I got on the lift chair, and there's a ski patrol guy, and I was like, how do you know if you have a broken rib? He's like, if you can take a deep breath, you don't have a broken rib. And so I took a deep breath, and it was a little uncomfortable, but, you know, it settled after like 20-30 minutes, and after that week it got better. But I always noticed that, like, from that moment on, I had a weird, like, tension right here, right near that lower rib, and that was like almost 9 years ago at this point. And so I remember when I got my lesson with Jamie Bandera, he was always saying, like, he was saying that I needed to support more for my diaphragm. And so I did that, and I got the crisp, clear sound, and I know I was doing the practice right when he watched. But ultimately, whenever I went through like Ken Tamblin's program, and I was doing the scales, and I was doing the breathing exercises, and I was, you know, clenching down on my diaphragm, kind of like Jamie said, if I did it too much, it just hurt. It hurt so bad right in this area, and it was just, I think, just subconsciously I was trying to avoid using it because it just hurt. And every time I was doing those exercises, the ha 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 at the end of it, it would just hurt. And so recently, I also had hip surgery, and this is related too. I'm gonna tie this back in a minute, but, you know, so before hip surgery, I had a lot of chronic pain for probably like 6 or 7 years, just a lot of chronic pain, like in my pelvic region, my lower back, my hamstrings, my hips. It was a lot, you know, and ultimately, like, I didn't realize just how much all these muscles in here were kind of compensating for how much pain was in my hip until I got surgery on it. And then from after surgery, I started singing again, and I started getting my voice back. And then something really interesting happened. I started getting a really tight spot right in here, one of these muscles that connect down through the leg. And I don't really know. I'm not like a doctor or anything, so I don't fully understand, you know, what muscles are called what. I just knew there was a really tight spot right in here. It's still there a little bit, but, you know, I started really working on it, and I took a lacrosse ball and I just kind of jammed it kind of in there and around my hip, and then I was at work one day, and I just kind of was massaging my left side too, where I had all that pain, and just really breathing deep into it, and I got this really big release. And there's still tightness. I'm actually getting a massage tomorrow. Hopefully I'll be able to work some of that out, but there's still a good bit of tightness there. But something crazy happened as this muscle on my right side, where I got the hip surgery, settled down, and this one started to settle down. My voice started opening up a lot. It started becoming a lot more clear. It started becoming easier to sing. It felt like when I had that lesson with Jamie Bandera the first time, except it didn't start hurting. It stayed comfortable. So I just really want to emphasize how important it is to take care of your whole body. If you have an injury and you're sitting there, like, don't do what I did and just hope it gets better and not do anything about it and just kind of ignore it. I had other pains too that I was trying to take care of. You know, obviously the hip and everything over here, my shoulders, like there was a lot going on. When you snowboard a lot, you just beat the crap out of yourself and you end up with a lot of misalignments. But so my left rib was the least of my worries, but it was hindering my voice so much. And I'm gonna try to demonstrate. I'm not like fully warmed up right now. I warmed up earlier though, so my voice should be good. But I want to just kind of try to demonstrate what the difference is between having that support and having that release and what I was doing before, which I was compensating with my throat, and I didn't even realize it because if I tried to use my diaphragm too much, it would just hurt. So I was like, well, it can't be right if it hurts. But once I released that, it was just, you know, it was good. So there's a song that goes, it's like, and I'm going to do it first in like the kind of voice I was doing before with compensating on the throat. How will you make them remember your name? So it's still open, it's still hitting like the kind of the soft palate as it raises up. It's pretty effortless, but it's kind of covered and it's dull. Whereas if I do it straight from my diaphragm, how will you make them remember your name? That wasn't like perfect, but hopefully you can hear the difference. How will you make them remember your name? So that's kind of unsupported. And if you go to supported, how will you make them remember your name? It's a lot more crisp, it's a lot more clear, and it's coming straight from here. Still not perfect yet. Again, this literally just happened like a few days ago for me, like last week maybe, where I started getting the release and these muscles finally started to relax, and I'm finally getting past, you know, I'm getting on the tail end of my recovery from hip surgery, so those muscles are just going to get more relaxed, and I'm really excited to see where my voice goes. But hopefully you could hear the difference there in a supported voice versus a non-supported voice. I was not singing in a supported voice. So really make sure you take care of your whole body, your torso. If you have tension there, you know, get it treated. Go get physical therapy. Go get a massage. Go get myofascial release. Go in there with a lacrosse ball if you need to, and really dig in. But this stuff's important. I'm still, you know, developing the muscles around my diaphragm. And as I overcome this tightness and all these weird injuries I've had, my voice is just going to get stronger. I'm really excited to see where it goes. But yeah, now that it's cleared up a bit, you can guess who needs a lot more practice on this technique now. This guy, you know, because my posture was right, my breathing, my inhales were correct, and you know, I was doing exercises, my range is good, but something was just off, and it was just this little bit of tweak. And so it was also, I'm gonna make another video here in a minute, but I was also like messing with the foundation. But make long story short, take care of your body and don't let injuries just sit.